Hello, everyone. Welcome to our weekly small ruminant health program and management program. I'm your host, Sarah Jamansky, Purdue Extension educator for Perry County, Indiana. Today, I was really hoping to have a veterinarian to talk to you about sheep and goat disease prevention and treatment, but unfortunately, all of our veterinarians are very busy with the current COVID-19 and various things that they're involved with. And so I'm going to be presenting this as a producer and from an educator perspective. And so I will not be able to give you medical advice, but I can give you an overview of some different diseases and biosecurity in sheep and goats. I will go ahead and take questions at the end in the interest of time. That way, because there's a lot of material to cover. So the key to flock health overall, disease prevention and treatment, is good management. You want to prevent disease before it ever happens. And this starts with having a veterinary client-patient relationship. You need to make sure that you have a good relationship with a livestock veterinarian in your area. Even if that veterinarian does not have a history with sheep or goats, they have the training with other ruminants where they can learn what they need to about sheep and goats. If you have a veterinarian that doesn't have a sheep and goat background, you could gift them a book such as Mary Smith's Goat Medicine. So there are a lot of resources available for goat and sheep, veterinary sources. And so if you have a veterinarian that doesn't have that experience, be sure to work with them. And they definitely have the medical background to be able to help you. So your veterinarian needs to be able to visit your farm at least once a year. And then this gives them an idea of your practice and of your practices, your management practices, how you maintain your animals. And they can take a look at your management practices and make some recommendations for improvement so you can help prevent disease on your farm. I'm sorry, this picture is of pigs. Unfortunately, Purdue did not have a picture of a veterinarian with goats and sheep. But still, it's important to have that annual veterinary visit so they can be familiar with your farm and your management practices. And then when you call them for advice, then they can give you more knowledgeable answers. You really need this VCPR because if you ever want to use prescription drugs, those have to be prescribed by a veterinarian. If you ever want to use an antibiotic in feed or water, that has to be prescribed by a veterinarian. If you need to use anything extra label, that has to be prescribed by a veterinarian. So extra label is using an over-the-counter drug in a manner that is not on the label. So this could be giving a higher dose than is needed, than is on the label. It could, if it's required, it could mean using a sheep product on goats or a cattle product on goats or sheep. And so most of your veterinary products do not include goats on the label. So for most of your veterinary drugs, you do need an extra label prescription from a veterinarian. The veterinarian will help you calculate withdrawal dates for milk or meat. Some other things you need a veterinarian for are for health certificates. So if you're going to be transporting any animals out of state for any reason other than slaughter, you need a health certificate. If you need TB or brucellosis testing because you're transporting out of state, that requires a veterinarian. For any surgical procedure that requires anesthesia, you need a veterinarian. If you need a referral to a specialist, you have to have a veterinarian that sees your herd regularly. If you need rabies vaccinations, that needs to be performed by a veterinarian in most states. There are some things you can do yourself. So some of your biosecurity testing, if it's not a state-regulated test, such as caprine arthritis encephalitis or ovine progressive pneumonia, and some of the other tests, you can draw blood yourself and submit it to the laboratory. So veterinarian is not required there. So there are things that as a producer you can do yourself. You can do most vaccinations yourself, with the exception of rabies. And then you can use over-the-counter drugs according to their label. And that's the tricky part with goats. Sheep producers have a few more options, but with goats, we have very few drugs that are labeled for goats. Disbudding of young kids in the United States, you can do that without a veterinarian. And tattooing goats, again in the United States. Some countries do have some restrictions on tattooing and disbudding, because they may require pain management, which again requires a veterinarian. But before you even get started, don't buy problems. The first thing to do is take a look at goats or sheep that you might be buying and determine if there are problems that you could be bringing into your own herd or flock. Or if you're starting brand new with a herd or flock, you don't want to introduce problems from the get-go. It's a whole lot easier to prevent it than to treat it. So the first step is to buy from a known source. So you don't want to go to the sale barn, you don't want to go to Dinky's in southern Indiana, for instance, and buy your breeding goats or sheep from there. You have no idea of the history of these animals. They've been commingled with a lot of other animals with unknown histories. So this is the worst place to buy goats or sheep if you're wanting to breed or show or anything of that nature. If you are looking at animals just to grow out for meat, it may be an option. Again, these are terminal animals. You want to keep these animals away from any breeding stock. But if you're looking for breeding stock, you want to make sure they come from a known source. You want to make sure that the breeder that you buy from has a sound herd or flock health plan. Are they disease testing? Do they have a veterinary client-patient relationship themselves? And a show breeder is not necessarily breeding healthier animals, so you want to do your research when it comes to any breeder that you're buying from. Purchasing through a production sale can be an option, but make sure that you do your research on those farms and their herd health practices or their flock health practices before you purchase. I know this is a big thing in the boar goat industry. There are a lot of great production sales out there. You just want to make sure that anything you buy has been disease tested and that it comes from a farm that has a good herd or flock health management plan. And so that's where doing your homework comes in. So talk to the breeder. What records of testing do they have? Do they test for CAE? Do they test for Johne's or caseous lymphadenitis? Do they vaccinate for any of these diseases? How do they raise their lambs or kids? So this is particularly of interest in the dairy world with dairy goats, because CAE, caprine arthritis encephalitis, is passed through milk or colostrum. And so you want to see, what is their kid rearing protocol? Are they using CAE prevention? And if not, have they tested the animals that the milk is coming from to ensure that they are CAE negative? And then also ask about the deworming protocol. We don't get into that in this presentation. We'll talk about this in more detail when we talk about parasite management. But if you look at a herd or flock that deworms on a schedule, then you're more likely to bring in resistant parasites into your own herd or flock. Because when you have a schedule, then the parasites that are in that herd or flock build up resistance to those drugs that are being used. And so when you're going to purchase your animals, you don't just want to look at the animals you're purchasing. So you're best off not just meeting somebody on a parking lot and doing an animal swap unless you actually have been to their herd before and have seen their herd. Ideally, what you want to do is you want to visit their farm, see their management practices, and look at the entire herd or flock for concerning signs of disease. And if you see something that concerns you, make sure you ask questions about it and don't be afraid to walk away. And it could be that it's a minor issue, like maybe the kids have diarrhea because they separated them from their dams so that they could take pictures of the dam, and then the kids gorged on the milk on dam-raised kids. That can cause diarrhea, so maybe it's not a big deal. But if you have scouring due to coccidia or other issues, you might want to take a look at that and decide if that's something you actually want to deal with. So you want to do a pre-purchase health check. And this can include disease screening, and it can include looking at the animals. So when you're looking at that herd, you want to, first of all, say, where are these animals coming from? Am I buying from out of state, and does my state require a TB or brucellosis test to import animals from that state? For instance, if you live in the state of Mississippi, you will need a TB and brucellosis test on anything coming into your state. If you live in a state where I do, like Indiana, you only need it from states where you have an endemic population of TB, or TB is spreading endemically, such as Michigan. And so in Indiana, we would need a TB test on any goat or sheep coming from the state of Michigan. And again, it just kind of depends on your state and where the animals are coming from. But if your state does require TB and brucellosis testing, then you want to make sure that you have a veterinarian perform those tests on those animals, or that they come from a certified and accredited herd. There's also the option for a biosecurity profile. And for a breeding herd, it's not a bad idea to, at the very least, have a CAE test done on any animals that you're purchasing if they don't come from an already tested herd. So if the herd is already testing on an annual or semi-annual basis, then you don't need to have an individual test. But if you are interested in genetics from a herd that does not test for CAE or OPP, which are related lentivirus diseases, then you want to make sure that you get that test done before you bring the animal home. And so most of your labs are going to offer an ELISA test. It's very sensitive. The specificity is about 98%. So what that means is you have a very, very low false negative rate with an ELISA. You have about a 2% false positive rate with ELISA. So what this means is that if you test 1,000 animals for CAE, you probably won't have any false negatives. If we assume that the prevalence in the population is 10%, that approximately 10% of goats have CAE, and you have a 2% false positive rate, out of 1,000 goats that you test, you'll have 120 come back positive. Of those 120, 20 will actually be a false positive. So what I recommend is that if you have a positive test on the ELISA test, then you retest through a laboratory that uses the agar gel immunodiffusion, the AGID test. So this test has a lower sensitivity, so it does have a greater false negative rate, but it's very specific, so you have practically no false positives. And so if you have an animal that tests positive on both the ELISA and on the AGID tests, you can be sure that this animal is positive and you need to treat it as such. And if you're purchasing, it may be one that you elect not to purchase. If it's within your own herd or flock, you may elect to manage it within your herd or flock and work with a veterinarian on how to do that. If it is ELISA positive and AGID negative, I would consider suspect. And again, if you're purchasing from someone else, then I probably wouldn't purchase a suspect animal. But if it's within your own herd or flock, it's one that I might keep for 6 months and then test again. Some things that we see that could cause a false positive is if an animal has been recently vaccinated. And so false positives do occur with the ELISA test. They do not typically happen with the AGID test. And so if you have two tests that disagree, then that's one where you can wait and then retest later. There's also a PCR test, which I did not list on here, available for CAE and OPP that can help confirm one way or the other. So Johne's, the Johne's test for Johne's disease. It has probably a greater false negative rate. It's not very accurate in younger animals. It's going to be most accurate in animals over 4 years of age. So your best bet, if you're wanting to see Johne's test results, is to have herds or flocks that test every animal over 4 years of age. That's going to be your most accurate test. And then caseous lymphadenitis. Again, with this one, individual tests are not particularly accurate. You're best off with a whole herd screen. And if a goat has been vaccinated for CL, then you can have a false positive test result. And so, again, Johne's and CL are not really tests that are accurate for individual animals. You have to have a whole herd test result to get any kind of good information from those tests. So there are also things that you can look for when you're reviewing a herd. So caseous lymphadenitis is one that you absolutely do not want to get into your herd or flock. So you want to make sure that you examine the entire herd. And so what you want to look at is you want to look for abscesses around the lymph nodes. The lymph nodes, you can find them under the ear, on the throat. There's some kind of in front of the back legs. And so if you look at a chart of lymph node sites on goats, that's where you want to look. Now, not all abscesses are going to be from caseous lymphadenitis. Some of our vaccines will cause vaccine reactions that can look like an abscess, and in those cases, they will be sterile. And typically, a vaccine is not going to be given over the lymph nodes. But if there is a herd with any animal that has any abscesses over a lymph node, I would not buy from that herd or flock. Pink eye is another one. This one, it's a nasty disease, but it's not a long-term disease. It's not like caseous lymphadenitis or CAE where it's essentially uncurable. In caseous lymphadenitis, it's treatable, and it is manageable, but it's not fun to manage. But pink eye is something, if you can avoid it, you want to avoid it. Unfortunately, if you show a lot, at some point, you're probably going to bring pink eye home to your herd or flock. So look for cloudy eyes, look for runny eyes, discharge. If there's any kind of discharge from the eyes and it's not obvious that it's from irritation from the environment, I'd be careful purchasing an animal from that herd or flock. And this is potentially a zoonotic disease depending on what strain of bacteria is causing the pink eye. And pink eye can be viral as well. So there are a number of different causes of infectious keratoconjunctivitis or pink eye. Okay, ringworm, also known as club lamb fungus. So this is one that unfortunately you're likely to pick up at shows. But if you have a choice, if you're looking at animals to purchase, if you're seeing any sign or symptom of ringworm, walk away. It's just a pain to deal with. So what you will see is typically circular patches of hair or patches of hair that's missing. So it's within the coat. There will be hairless patches that are scaly or discolored. A lot of times you'll see it first on the head or the ears, but it can be on any part of the body. And this is a fungal disease. Even though it's called ringworm, it is actually a fungal disease. There are a few different fungal species that can cause this disease as well. And it is highly contagious between animals, and depending on which species is infecting them, it very well can be zoonotic. So you can get it from your animals. So if you see this on a herd or flock, you want to make sure that you wash thoroughly afterwards. You don't want to get this on yourself. And again, use caution if you do get it in your herd from a show or something of that nature to make sure that you don't catch it from your goats or sheep. Contagious eczema or sore mouth, also known as ORF. So this is another one you want to watch out for. You don't want to bring it home. It causes scabs and blisters. Usually it will start around or inside the mouth. On the lips, if you have it inside the mouth, it can cause difficulty in eating. And some people have to tube feed kids if they get a very severe infection inside the mouth. But pretty much any part of the goat or sheep that has less hair, you're going to see it. So you often see it at the top of the hooves, on the tail, particularly the underside of the tail, and on the udder. A lot of times the does will catch it from their kids if you have infected kids that are nursing. It is caused by a pox virus, and it is zoonotic. So you do want to wear gloves around infected animals. It can cause very painful blisters on your hands. And this is going to be reportable to any state veterinarian in any state because the symptoms are similar to foot and mouth disease. And so it is a reportable disease in most states. Okay, caprine arthritis encephalitis and OPP. So these are two related lentivirus diseases. And often you can have animals that are carriers for months or years. So you want to make sure that your herd or flock is willing to test any animals over 6 months of age before you purchase. And once you do start to see symptoms, you can see swollen joints on both sheep and goats. You can see progressive lameness, weight loss in both sheep and goats. In sheep, you may see difficulty breathing. But please note that not all swollen joints or arthritis in goats are caused by CAE. So you make sure you have a positive test before you say for sure that it's CAE. There are other conditions that can cause arthritis in goats. There are other conditions that can cause swollen joints. There are infectious causes or injury. And, so founder laminitis. So there are a number of different things that can cause these symptoms. But again, in addition to this, you might see a hard or swollen udder on both sheep and goats. They may be more prone to mastitis. So this is something you just really don't want to bring into your herd or flock unless you really know what you're doing and you just can't live without the animal and you're willing to manage it. But if you do manage it, you want to make sure that you are going to heat treat colostrum and feed pasteurized milks to lambs or kids and have a strict CAE prevention program for your young stock. And respiratory disease. This can have a lot of different causes. It could be viral, it can be bacterial. You could have different colors of mucus. It could be due to the environment. It can be a symptom of pneumonia. So you want to avoid buying animals with active respiratory infections. Most herds or flocks will have respiratory infections go through the herd or flock from time to time, but you don't want to buy it. So there are, again, a lot of different causes of respiratory infections. It's not something you want to buy, but it probably is going to happen in your herd or flock at some point. So we're going to talk about disease prevention. So anytime you bring a new animal into your herd or flock, or anytime that you have an animal that leaves to go to a show and comes back, you want to isolate them. You want to quarantine them for at least 30 days. But even before that, we need to make sure that we have good nutrition for our animals. And I'm not going to go into detail about nutrition because we talked about that in detail last week with Dr. Neary. But a lot of our disorders in goats and sheep can be prevented through proper feeding and supplementation. So just want to understand, like what Dr. Neary talked about last year, that different stages of production have different requirements. And you need to make sure that you are feeding your animals based on the requirements for their age and stage. You want to make sure that you're body condition scoring your animals. So Dr. Neary talked extensively about body condition scoring last week, so I won't go into detail about that. But just make a note that you need to learn how to work with your extension educator or an experienced producer and learn how to body condition score your animals. There are resources available through Langston and through University of Kentucky, through the American Dairy Goat Association, to learn how to body condition score sheep and goats. So you want to make sure you incorporate biosecurity practices both on and off the farm. So you're preventing disease from entering the farm or spreading once it's on the farm. So when we talk about external biosecurity and internal biosecurity, so external biosecurity is preventing outside diseases from entering your farm. So you want to make sure that if you leave the farm, especially if you're going to a sale barn, if you're going to a fair, any place where there are other animals, you want to make sure that you use different shoes when you leave the farm than you use on the farm. So have a set of barn shoes that you just use in your barn that you don't take anywhere else. If you visit other farms or fairs or other places with livestock, change clothes before you visit your animals. If you have visitors, keep some shoe covers. Offer shoe covers to visitors. And again, you want to quarantine animals that have left your premise, have returned, or new animals to the farm. And again, you want to quarantine for at least 30 days. That'll give you enough time to see if there's anything that pops up, that they may have caught some kind of infectious or contagious disease while they were off the farm. And then we move to internal biosecurity. So this is what you want to do on your farm if you have an animal that gets sick. So first of all, you want to isolate your sick animals, and you want to handle them last in case whatever you're dealing with is an infectious or contagious disease. And so if there is a known risk of a particular disease, such as CL perhaps, you want to vaccinate susceptible animals. And sore mouth is another one where you would have a vaccine available if you know that is a risk. And then if you have animals that leave the farm for a show, you want to make sure you test for communicable diseases like CAE and OPP annually. Because while they are not easily spread from animal to animal, they can spread from animal to animal. And if you have animals that are off farm, particularly if they're going to major shows, then there's always the opportunity that you could have some transmission of these diseases. If you know that you have CAE or OPP present in your herd, you want to make sure that you isolate the positive animals in their own area. You're going to milk them last if you milk. You're going to handle them last. And you want to remove kids or lambs at birth and then feed either colostrum replacer, colostrum from a negative doe or ewe, or heat-treated colostrum and pasteurized milk, or a milk replacer. But again, you don't want, because these diseases spread primarily through milk and colostrum, you don't want to feed untreated colostrum or milk to the kids of CAE or OPP positive animals. But really, the key to a lot of disease prevention is sanitation. And this could mean sanitizing and disinfecting your trailer when you bring it back from a show before you get onto the farm, ideally. Or it could mean sanitizing within your own facilities. So barns and sheds are a major source of disease transmission within your farm. And so you want to make sure that you have adequate shelter for the number of animals. If you have animals that are confined in very close quarters, disease is more, particularly respiratory disease, is going to spread more rapidly. You want to make sure that you clean out manure regularly. Some respiratory diseases start as irritation of the respiratory tract due to high levels of ammonia. So you want to make sure you keep ammonia levels low. You want to make sure that they always have clean, fresh bedding, so you don't have them sitting in wet areas. You don't have dirt getting on or manure on the skin. You want to make sure you keep your feed off the ground and the feet out of the feeders. That way you don't have contaminated feed. So this will reduce the transmission of coccidia and other parasitic diseases. You want to make sure they always have access to clean, fresh water, and that the area around the water trough is drained and kept dry. And again, this will help prevent some of our diseases that like moisture, particularly your hoof diseases. You want to put your hands on the animals whenever possible. That helps you determine body condition. It helps you feel the coat texture. Does the coat feel like it's luscious and smooth, or does it feel rough and dry? You want to make sure that you keep the hooves trimmed regularly, at least on those, or at least monitor the hooves. If you have animals that don't need regular hoof trimming, at least keep an eye on those hooves and make sure that you don't have overgrowth or other issues starting. If you have a dairy does, you want to keep the hair on the udder trimmed. That will reduce the amount of moisture on the udder and help reduce disease. You want to check for lice and other ectoparasites and treat appropriately if you find those. And then it helps to have a sanitary clip before kidding. That'll help just keep everything cleaner and drier. So let's go through some of the diseases that we might see within a herd or flock. So diarrheal diseases. The diarrhea can be caused by a lot of different factors. And so these are gastrointestinal disease. And so we have diarrheal diseases that are non-infectious, and that's diarrhea that's caused by stress or nutrient imbalances. So you could have a recent environmental change, such as moving the animal to a new environment, such as a show, a sudden change of the weather, trailering, anything like that. So in that case, you want to acclimate them as slowly as possible to the new environment. For instance, if you've purchased a new property, you're moving them to a new barn. It may not be possible to slowly acclimate them, but do what you can. But bring familiar food with you if you're traveling. Another thing is a recent feed change. So if for some reason you can't get the feed that you used to feed, and you have to change feed, try to transition as slowly as possible. Mix your new feed in with your old feed and get them gradually accustomed to it. And maybe you have a change in your hay supplier. So again, offer some of the new hay and some of the old hay at the same time. Sudden growth of new pastures. So spring pastures are another time, if you have a very high protein, highly nutritious pasture out there, and you're going from hay to pasture, and you can see diarrhea from that. And then also toxic plants could be a potential. You might add some probiotics to the diet that can help improve gut health. And you want to make sure that you prevent overeating. You want to prevent break-ins to the feed room. So all of these can cause diarrheal disease. And some of these can promote the overgrowth of bacteria, such as Clostridium. So we have diarrhea that's caused by bacterial infections. So this is one of our infectious sources of diarrhea. So Clostridium, E. coli, Salmonella, and others are various diseases that can cause diarrhea in sheep and goats. And all of these are pretty serious in sheep and goats. And so vaccinating for CD&T and other clostridial diseases can help quite a bit, but it's not going to be 100%. If you have an animal that stopped ruminating, you could use a cud transplant. But oral antibiotics can help treat some of these diseases, but you want to make sure you consult your veterinarian before using antibiotics. And then if you have one that's sick, using CA&D antitoxin can help. Again, there's no silver bullet cure for diarrhea. It just you have to identify the cause and treat it as best you can with your veterinarian's assistance. And then we also have diarrhea that's caused by parasites. Coccidia and Giardia commonly cause diarrhea, with coccidia being more common in sheep and goats. So again, you want to keep your feeders elevated to where they can't put their feet in their feeders. Have your feeders on the other side of the fence if possible. If you have horned goats, you want to make sure that you have, you can still feed them on the other side of the fence. You just want to make sure they can get their head with their horns in and out. You want to make sure you keep your pens clean and not overcrowded, and use a coccidiostat in feed to prevent overgrowth of coccidia. So that could be something like Rumensin or Bovatec, something of that nature. Rotating pastures to prevent overgrazing can help. Rotating pastures in and of itself isn't going to help if you rotate too quickly. But if you can at least keep the forage height a little bit higher, that will help reduce the number of gastrointestinal parasites. And so your gastrointestinal nematodes that typically cause diarrhea are going to be your Telodorsagia and your Trichostrongyls. And so Haemonchus contortus, which we'll talk about with parasite management, doesn't typically cause diarrhea. It's more your cool season parasites that are more likely to cause diarrhea. And now they're around more than just the cool season, but they tend to be more of a cool season problem. But you can feed a supplement containing a nematode-trapping fungal spores during the months that the worms reproduce. So that's one thing you could do. And deworm as needed. So these are some things you can do to address diarrhea that's caused by parasites. So a lot of our diseases in sheep and goats are metabolic diseases. So diarrhea is a metabolic disease, but we have a lot of other kind of diseases that are caused by the metabolism. So bloat, so you see gas buildup in the rumen. So you have various causes for bloat, such as choke bloat is when something blocks the esophagus and prevents the regurgitation. Then you have dry bloat where you have too much grain in the diet. And then frothy bloat is the result of high protein fresh greenery in the spring. So in general, in the rumen, you have a lot of microorganisms. These microorganisms break down the plants that goats and sheep are eating. Excuse me. So as they break down these plants, they're releasing gases. These gases come into the rumen, and then a goat or sheep is going to burp up the gases as they're regurgitating. But if you have a lot of grain where they're producing more gases than what the sheep or the goat can burp up easily, then you're going to have the dry bloat. Or if you have more protein, a whole lot of protein in the diet, and they're producing more gases than can be, burped up easily, that's where you get the frothy bloat. And so what you want to make sure is you don't want to feed things like corn cobs that can get stuck in the esophagus. And you want to make sure that they have a high roughage diet. That's going to help prevent the dry bloat. Because if you get too much grain, they can get acidotic. You can get an acidic rumen, which is not what you want. You want close to a neutral pH in the rumen. And again, you don't want too much protein, too much easily digestible protein in the diet. So you want to limit access to spring pasture and or provide a feed or supplement that can reduce bloat. And so introducing a tannin-containing forages or roughage such as Sericea lespedeza pellets or Rumensin or Bovatec, those can all help reduce bloat. Nutritional deficiencies. These are another major cause of problems in sheep and goats. So you could have not enough of a nutrient, or you could have too much of a nutrient in the diet. So having forage tests is really important to make sure that you have adequate supplementation, and then compare that with your feed labels to make sure that you're providing enough nutrients. And we talked about that last week, so I'm not going to go into detail. But another problem that we see is too much of one nutrient blocking absorption of another. So copper can prevent absorption of zinc, or vice versa. So you want to make sure that that's not happening. So again, work with a nutritionist to make sure that you're not over supplementing one nutrient. Another issue can be iron and calcium. Calcium and iron can cancel each other out sometimes. Or you may have an animal that's not ruminating, and so they're not synthesizing their B vitamins. And so in this case, you want to make sure you administer vitamin B to an animal that isn't ruminating to be able to replace the thiamine that's not being produced by their body. And so we have other metabolic diseases that we see during pregnancy. So ketosis and pregnancy toxemia are metabolic diseases that are caused by the ewe or doe metabolizing fat because she can't eat enough to meet the caloric needs of her fetuses. And so usually this is an animal that is either very overweight or very underweight, and she just doesn't have the room in her gut to be able to eat enough food to feed these fetuses. And she has a high fetal demand. And so you're seeing multiples, triplets or quadruplets you're going to see more likely to have this happen if you have litters with more than twins. And so now milk fever or calcium deficiency can have similar symptoms. And if it is calcium deficiency, that will resolve very quickly with calcium treatment. But if it doesn't, propylene glycol and inducing delivery are the treatments for this. Respiratory diseases are one of our more common communicable diseases that we see in sheep and goats, but they can have both infectious and non-infectious causes. So when we're talking about infectious causes of respiratory disease, we're looking at bacterial disease, viral disease, and parasitic disease. So a bacterial disease is going to be any respiratory infection that's caused by a bacteria. And a lot of times you'll see pneumonia in sheep and goats, and pneumonia can be kind of sneaky. So if you have an animal that has labored breathing, even if it doesn't have a snotty nose, labored breathing and a fever, then consider pneumonia. Definitely work with your veterinarian for a treatment plan if you have any symptoms of a respiratory disease in your herd. But this is something you want to make sure you avoid contact between your animals and somebody else's snotty-nosed animals at a show. But again, a lot of these diseases are viral, and antibiotics aren't going to help a viral disease. The other thing to consider is nasal bots if you have a chronic respiratory disease, or a lungworm potentially, are things to consider if you have a chronic respiratory disease that doesn't respond to antibiotic treatment. But there are also non-infectious causes of respiratory disease. High ammonia levels in the shed or barn can cause irritation to the respiratory tract. And so you want to make sure that you replace your bedding frequently to prevent high ammonia concentrations and make sure your barns are well ventilated. Then also dusty conditions. So you could have, if you have dusty haze, that can cause respiratory problems. So you want to make sure you control the dust in your feed and in your barn to help prevent respiratory problems in your animals. Then lamenesses. So lameness is any hoof or leg disorder that causes difficulty in mobility. And so most of our causes of lameness are non-infectious. So it could be an injury to the leg or the hoof, founder or laminitis, which is a metabolic disease, or improper hoof care. So to prevent injury, we want to make sure that we're regularly inspecting our facilities. Check for holes, things they could step in, check for places where they can put their foot through a panel and get it stuck. Anything that could cause injury, just kind of inspect your facilities regularly and monitor animals for injury. So founder laminitis is usually triggered by a sudden increase in the amount of starch available to the animal. So you want to make sure, but it can also happen if you have a change in the animal's needs. So if you late pregnancy, you'll sometimes see animals get laminitic or right around the time of kidding. And again, you have some metabolic changes in the animal that can cause these issues. Maybe she's, right after she freshens, she suddenly has a big appetite because that load of kids or lambs is gone. And so you will see more laminitis and founder around the time of freshening. And so ideally, if you have a dairy goat or you have a show goat, you're going to need to trim every 6 to 8 weeks. Those sheep and goats that are bred for pasture, some of your hair sheep that have been bred to have better feet and to be on pasture, they may not need frequent trimming. But trimming too short or waiting too long to trim, either one of those can cause problems with the hooves. And we'll get into more detail on this in a couple of weeks when we talk about hoof care. But we also have some infectious causes of lameness. The first one being hoof rot. So hoof rot is bacterial, and it can be very contagious. But typically you see the most problems with hoof rot in areas where the animal has to stand in wet areas quite a bit. So a lot of mud around the watering troughs. If you have constant wet bedding, these are times when you can see hoof rot spread. And hoof rot can be a kind of nasty disease. You want to make sure you avoid sharing hoof shears and other equipment with other herds or flocks that might be infected. You want to make sure you keep your bedding and the area around your water troughs dry to prevent hoof rot. You can treat it with a copper-based, some of these copper-based hoof rot treatments. And then caprine arthritis encephalitis and OPP can cause progressive lameness over time. If you see the swollen knees of the goat in the picture, this is something that progresses very slowly, but it can cripple the goat or the sheep over time. So now we're going to talk about neurological diseases and disorders. So these are very serious conditions. Some are treatable, some are not. But all of them are serious conditions. So we have some non-infectious neurological disorders. And so these are goat polio, which is a thiamine deficiency, and it's usually secondary to some kind of gastrointestinal disease that causes a goat to stop eating. And so in this case, you want to make sure that any goat or sheep that's non-ruminating is supplemented with a vitamin B source. And the other non-infectious cause of a neurological disease or disorder is brain damage due to disbudding. And this is usually seen in dairy goats because dairy goats are disbudded most frequently. So this happens if the iron is not hot enough typically, and so the iron is kept on the skull longer in order to achieve a good burn. And so then you have the heat from the iron that's working through the skull and causing an encephalitis in the skull. And so typically this is going to be fatal. So you want to make sure that you use caution if you're disbudding goats or sheep to make sure that the brain is not exposed to too much heat. So you want to make sure that you have a very hot iron and that you're able to disbud quickly. There are several infectious neurological diseases that affect goats and sheep. Listeriosis is probably the most treatable of all of these. Meningeal worm is somewhat treatable, but I've never seen one with 100% recovery from meningeal worm. So listeriosis is caused by a bacterium. It thrives in areas where there's moisture. So if you have wet hay or silage or wet feed, then you can have the listeria bacteria reproducing in there. Now, so if you are going to feed silage, you want to make sure that the pH is below 4. And the listeria bacteria can't survive in that low of a pH. So silage is fine to feed as long as it has an adequately low pH. With listeriosis, you're going to see a head turn and circling are typical symptoms of listeriosis. Meningeal worm is a parasite of deer. Goats and sheep are not normal hosts for this parasite. And because of this, it behaves differently in sheep and goats than it does in deer, and it causes neurological damage to sheep and goats. And so your best prevention is preventing deer access to the pasture where you're keeping your sheep and goats. And snails are the intermediate vector, so it's carried from deer to snails, and then the snails are eaten by a deer or a sheep or a goat, and that transmits the meningeal worm. Rabies can be prevented through vaccination. There is no effective treatment for rabies. And so if you're concerned about rabies, if there's a high prevalence of rabies in wildlife in your area, you might want to consider vaccinating your sheep and goats. Then tetanus. Again, it's really hard to treat tetanus, but it is preventable by vaccination. And so your CD&T vaccine contains tetanus. The T in a CD&T is the tetanus toxoid. So if you have an animal that has potentially been infected, you can give tetanus antitoxin to prevent the onset of the disease. But once the animal is symptomatic, it's really hard to save it. So an antitoxin provides immediate short-term protection. A toxoid provides long-term protection. Then we have our prionic diseases. So these are things like scrapie, BSE, and chronic wasting disease. And so with sheep and goats, we typically are just going to be concerned about scrapie, but we need to be aware that some of these other prionic diseases can potentially affect other animals besides cows or deer. And so the presence of scrapie is the whole reason why we have the scrapie eradication program in the United States. It's spread primarily through feeding ruminant products to ruminants. So you want to make sure that you don't feed ruminant products to ruminants. Fortunately, it's not very common anymore in the United States, but it is a possibility. And so you want to make sure that you participate in the scrapie eradication programs, or at least follow the guidelines for herd identification or flock identification and tagging. And if you have a neurological disease show up in your herd or flock that's unknown and you have an animal die of it, report it to your state veterinarian. They're probably going to want to test the animal and figure out what it died from. Because whether you're talking about rabies, whether you're talking about scrapie, all of these things are things that they want to know about. Now, skin diseases and disorders. So it's pretty easy to spot when an animal has a skin disease, but it's not always easy to diagnose the cause of it. We have some non-infectious causes of skin diseases, primarily nutritional deficiencies and allergies. And so in this case, we want to make sure that we have proper nutrition, make sure that we have proper supplementation, that there aren't any nutritional deficiencies in our animal's diet. And so we want to ensure that we have the right balance of our nutrients. And again, we mentioned before the interactions between copper and zinc. And so both of these can have some effect on the skin. If you have an animal with an allergy, you can treat with an antihistamine, but the most effective treatment really is to remove the source of the allergen, which may be difficult to do with sheep and goats. So I would work with your veterinarian if you have one that you think has allergies. And now we have a number of infectious causes. We have ectoparasites, such as lice. We have fungal infections and bacterial infections. And a lot of these, it can be hard to differentiate, and you may have more than one going on at the same time. So if you have a skin infection like this, work with your veterinarian to try to determine the cause. But a lot of times, washing with betadine or chlorhexidine can treat both bacterial and fungal infections, but it's going to take it's going to take daily washing a lot of times to clear up some of these skin infections. Then we have udder diseases and disorders. So because the udder is how the kids are fed and the lambs are fed, this is one of the most important parts when it comes to monitor for health of a breeding animal. So we have non-infectious diseases and disorders. So internal trauma is really common. It's specifically, especially if you have a newly fresh or just kidded doe or just lambed ewe, particularly if it's their first time. As the milk comes in, it can cause internal trauma to the udder because this udder is just not used to having all this milk, all this liquid in here. And so if you see the picture, this is a newly fresh Saanen doe. Yeah, she's never kidded before. This is her first time coming into milk, and she's coming into a lot of milk. And so you see how red that udder is. And that's from internal trauma caused by that. But also a lot of times at dairy goat shows, we will see people udder their animals to try to make them look good. Well, if you leave the milk in the udder too long, it's going to make the udder hard. It'll cause edema. It'll damage the inside of the udder. And so massaging the udder and using creams can help. And avoiding over-uddering at shows is important. And then you can have injury to the udder. So you could have them get a scratch from a briar or some other kind of injury, or even from the teeth of the lamb or kid. And so this can make it uncomfortable for them to be nursed or milked. And you need to watch, because in turn, if they're kicking off the kid or the lamb that's trying to nurse, then you can have the internal trauma because that side is not being drained properly. So you want to be careful and make sure that if there's an injury, that you can deal with it. You might have to hand milk it, even if you don't normally hand milk the animal, just to make sure that udder is being properly drained. Then we have our infectious causes. So mastitis is inflammation of the mammary gland, and it's typically caused by a bacterial infection of the udder. You can have a clinical infection, or you can have a subclinical infection. So a clinical infection is something that's obvious, that maybe you have stringy milk, maybe you have part of the udder that's turned purple and cold. Subclinical is where you might have a high bacterial count, but it's not obvious. Maybe the udder's a little bit hard. And so you can have the milk tested in a laboratory to see if there is bacteria that they can culture from that. But work with your veterinarian if you think you have mastitis to make sure that you're using appropriate antibiotics and that you have estimated the proper withdrawal time. But something really common is to see dermatitis or pustules on the udder surface. And this could also be scabs. And this is typically caused by staph bacteria. And so keeping the udder clean and dry is the most important thing to prevent that. And you could also use like a betadine scrub or something to help treat it. But some people say that selenium supplementation can prevent these pustules. I don't know that there's been any research to show that. But again, keeping a clean, dry environment is the most important thing if you have staph dermatitis on the udder. We have our reproductive diseases. And so our non-infectious reproductive diseases, including birthing difficulty or dystocia, rapid cycling, which is a hormonal problem. We have infertility, which it can be either an infectious cause or a non-infectious cause. You have urinary calculi, which is a metabolic problem due to an imbalance of calcium and phosphorus in the diet, and a retained placenta, which can in turn cause an infectious problem. It can cause a uterine infection. So you want to make sure that to prevent birthing difficulties, you keep your ewes or your does in moderate body condition. You don't want them too fat or too thin because you're more likely to have birthing difficulties. And then there are some diseases, some infectious causes of dystocia if you have something that deforms the lambs or the kids. Also, if you flush your ewe or your doe too much before breeding and you have multiple lambs or kids, then that can cause dystocia as well as a malpresentation. And so work with your veterinarian if you're seeing rapid cycling or infertility to determine if it's worth treating that animal or if that animal needs to be culled. And then make sure you have the proper calcium and phosphorus balance in the diet to prevent urinary calculi. And so with our infectious reproductive diseases, uterine infection is one to be concerned about. And so a lot of times this happens if you have residue of fetal material that's still in the uterus after a lambing or kidding, if you have a difficult lamb or kidding. And if she needs assistance, you might, if you don't use sanitary practices, and again, if she doesn't fully flush everything out of her uterus herself, then that can cause a pyometra or uterine infection. This is rarely fatal in sheep and goats, but it causes fertility problems. And you can have urinary tract infections, and those have causes, it's from bacteria entering into the urinary tract. And so it just kind of depends. It's going to be more common in a ewe or a doe than it is going to be in a buck or a ram because you just have a larger urinary tract there. Then infertility that we see in sheep and goats is typically secondary to an infectious disease, whether it's either infectious or non-infectious, such as the urinary stones. But a urinary tract infection, a uterine infection, all of those can cause infertility. So for more information, here are some resources. And again, you can find this from the version that is on the Google Drive. And now we'll take questions. I'll go ahead and post the links again for you. Okay. So if you're keeping a flock on pasture, not housed, should we do the quarantine always in the same place or fenced area? Or should we be worried that some resistant bacteria or fungi might survive in the ground? Should we rotate places from time to time for new quarantines? Probably your best bet for quarantine would be to have even if you manage in pasture, if you use extensive management, you should probably have a place that's either on concrete or on ag lime, crushed limestone, something like that. You want a dry lot. You don't want to actually quarantine on pasture. You want to quarantine on either a dry lot or a concrete pad. So you want to make sure that you can clean that area. If you cannot do that, then having different quarantine areas that you rotate might not be a bad idea. But ideally, you want to prevent your pastures from being contaminated by anything that these animals might be bringing in. So using a dry lot or concrete pad would be your best quarantine area. Preferably someplace that you can clean really well. Okay, what causes an enlarged udder with an unbred doe? So it's really common to have what we call a precocious udder. So this is caused by hormones, and particularly you see it most often in overweight does, dry yearlings, where they will spontaneously begin producing milk. Occasionally you could have mastitis get into a precocious udder, but typically it's just a doe that's spontaneously producing milk due to hormones. So what disease would be most important to test for in a small herd of pet goats? It really depends on what you're doing with your goats. You can do the biosecurity screen for the CAE, the Johne's, and cases lymphadenitis. But if they're staying home and if they're never going anywhere, then they're not a high risk to other animals. And if you're not breeding them, then it's not a high risk. But if you are going to breed, I would definitely suggest at minimum do a CAE test. If you're not going to breed, it's not as necessary if they're going to be isolated from other animals. Okay. Do I need to do anything to reduce the size of the udders? Do you milk or let her body take care of it? Okay, so it depends on the context. So if you have a doe where you're weaning the kids, okay, so with an unbred doe. In this case, I would not milk unless you feel like it's necessary for her health. Like if it's getting very large, if it's getting very full, you might milk. But in general, we try not to milk if you don't have to. Just monitor it. As long as it's soft, it's okay. But if it starts to get hard, there might be mastitis starting. But you can actually cause more problems by milking than by not milking in many cases. Okay, question. In cases of diarrhea, how can one distinguish between coccidiosis and bacterial diarrhea? So in this case, you would want to take a sample of the diarrhea to your veterinarian and have them check for coccidia. They can actually look at they can do a fecal float and they can look for coccidia in the diarrhea from your animals. And so then you can have a good idea of whether or not coccidiosis is the reason for the diarrhea. Any other questions? I'd like to thank everybody for attending. And please remember to complete the evaluation for this program. I'll give you the links again for both the Google Drive and for the program evaluation. So I'm going to go ahead and stop recording now.